The start of a new school year is right around the corner, and vaccinations could be one of the best ways parents can protect their kids from potentially harmful diseases. Paige McCoy-Smith from our sister station at WFAA in Dallas has more with Blue Cross Blue Shield.
The long days of summer are winding down, and it's time to return to the classroom. Many parents are wanting to know about vaccinations. Many questions about the confusing aspects about when to vaccinate and for what reason. I'm excited to introduce you to Dr. Momeka with Blue Cross and Blue Shield of Texas, a pediatrician. Tell us a little bit about vaccinations as we're getting closer to returning to the classroom. Why are these so important?
Good morning, and thank you so much for giving space for such an important topic. I've been a pediatrician for over 25 years, and my focus has always been about keeping kids healthy. That's been my agenda and priority. Vaccines keep kids healthy in two ways. First, they help your immune system build antibodies or proteins that help to fight infections like flu, measles, polio, meningitis. Secondly, they help prevent the spread of infection to others.
What are some suggestions you can have for parents to be on top of this important part of back to school?
Partner with a trusted voice that really shares parents' agenda in terms of keeping kids healthy, and that's their child's pediatrician. When you go in for well child visits and checkups, it's important to go in armed with questions about vaccines and other ways to keep kids healthy and thriving. You should also ask your child's pediatrician about IMTRAC2, which is the state's immunization registry. It's a database that stores all of your child's immunizations so that when any doctor actually wants to access information to know the vaccines that your child needs, they have it at the ready to know what your child already received and what they still need to receive.
When it comes to developing a relationship with a pediatrician, or for parents who are just beginning that process, possibly new parents or parents that have moved into a new area, what suggestions do you have for building that relationship, and why is it so key?
In that partnership, it truly is parent and pediatrician working together to make those decisions about vaccines and other preventive measures. As a newborn, your child is going to see their doctor in that first week of life, and then every 2 to 3 months until they're 18 months of age, every 6 months until they're 3 years of age. From age 3 onwards, they're going to see their child on an annual basis for yearly checkups. When your child is smaller, younger, they get vaccines against diseases like polio, measles, and pertussis or whooping cough. As they get older, they're going to be protected against meningitis and cancer-causing HPV.
What would you say to those parents that might have some hesitancy regarding vaccinations of their children?
Well, you're right, and we have seen decreases in immunization rates in some areas. In fact, most recently, there have been outbreaks of measles across several states. According to the CDC, the measles, mumps, and rubella vaccine, also known as MMR, is safe and highly effective. In fact, it is about 97% protective against measles if you're able to get 2 doses. I urge families to really partner with their child's doctor when it comes to getting clear, evidence-based information about vaccines and other health concerns.
What about parents that do not have access to resources? What is Blue Cross and Blue Shield of Texas doing to reach those parents to ensure that their children are receiving these much-needed vaccinations?
Blue Cross and Blue Shield of Texas has partnered with the Caring Foundation of Texas to bring preventive care into communities. The Caring Foundation is a nonprofit that works with businesses, religious organizations, government agencies to bring medical providers into the communities where families live. Their mobile units, Caravan and Caravan at School, provide vaccines, dental care, kidney screenings, and health education to all families in places where they live, learn, and work.
Anything else you want to say to parents before that big school bell rings and kids return to the classroom?
Vaccines are a safe and proven way to keep kids and teens healthy. And secondly, the Caring Foundation is truly a great organization that's doing amazing work across the state. So do check them out online at caravan.org.
Thank you so much for this wonderful and important information.
Thank you.
I appreciate it.
Thank you.
You can visit bcbstx.com and carevan.org to learn more.